Hi everyone, my name is Dr. Sanjith and I head the Department of Critical Care at the Raheja Hospital, a Fortis associate. Yes, there are reports that are trickling in that talks about a wave that is got into China from the Omicron lineage, and the lineage that is actually causing the problem is the BF7 Omicron lineage. However, what is important for us to understand is that we don't need to really panic about this. Now, why do we not need to panic? You must understand that COVID in China has been a very different way they have managed. First thing is, COVID was having extreme restrictive policies, whereas India did not have restricted policies. In fact, we've learned to live with COVID. When you look at China, they were still at a very strong restrictive policies, and they just opened it 1 month ago. 1 month ago, they went from restricting to zero COVID to living with COVID. Now, when that has occurred, coupled with the very poor vaccination program that has been conducted in China, knowing that only 1/3 or 1/4 of the population has been actually vaccinated, we know that this particular lineage, BF.7, spreads quite quickly. And that is what caused this. The loss of natural immunity as a result of infection plus the loss of vaccination together has actually made the population susceptible to problems of COVID. What we saw in the Delta or the second wave is what we are seeing now in the Omicron wave. All said and done, this does not mean that we should let our guards down. This means that this variant, because it is spreading excessively in China, can also mutate. So as the government is taking precautions by doing repeated genomic analysis to figure out whether there are some difficult mutations coming in which would change the virulence, we as individuals in the general population should take all precautions that need to be taken in this case, which includes what? Which includes A, the most important primary thing that we need to do is get vaccinated and boosted. Getting vaccination and boosted is very important because with the first booster, you have an 86% chance of evading the infection or not getting into the severer form of the illnesses. When you get the second booster, it gets even better. So it's but obvious that vaccination is the first key to preventing this virus from entering into the country. And yes, elderly patients, immunocompromised patients, patients who are on medicines that drop their immunity like steroids, patients who've got respiratory problems, very old patients who've just come out of recovery period from ICUs. These are those patients who should avoid crowded spaces, who should avoid going to spaces where there is a chance of getting the infection, who should always try to wear masks and keep distances away. This COVID appropriate behavior for these class of patients will make a very big difference to actually prevent COVID. You must understand that India, because of the natural infection that we've got in a large proportion of patients and the superior vaccination coverage that we've had, has actually developed something called as a hybrid immunity. And you must understand, hybrid immunity is better than natural infection. It is better than the immunity that you get from vaccination. So the total hybrid immunity of our country is so much thanks to the vaccination program that we've had in our country, that we are probably a bit more safer as compared to any other country in the world. So please do not panic. This is not the time to hit a panic button. However, it is important that we take care of our elderly immunocompromised patients and do help them to follow code appropriate behavior. Thank you very much.